The campaign to eliminate HIV has attracted several people and various stakeholders who are looking at the vision of ending HIV AIDS by 2030. They hope to achieve this through policy implementation and covering gaps in accessing prevention measures. James Tumsime, the country director at Reach a Hand Uganda, says a lot more needs to be done to address the increase of HIV infections, especially among the youth.
And for us at Reach a Hand Uganda, we believe that information remains the most powerful asset. Information remains the most important link to prevention, but also to care for persons already living with HIV.
Tumusime says Reach a Hand will continue to organize programs to create awareness among the public to prevent HIV/AIDS spread.
But we need the discussion to continue, especially to people that are hard to reach, people that are marginalized, sex work communities, people that are involved in same-sex relationships, people in fishing communities, the people that are not part of the mainstream community, because if we don't attend to the people that are already neglected by social settings, they will continuously cause more infection within the mainstream population.
Ibrahim Konge, Programs Manager at Reach a Hand, sheds more light on the event theme, Know Your Status.
Everyone has an HIV status. You're either positive or negative. So we want everyone to know their HIV status. And why we are doing this is because, first of all, the young people are the biggest majority in the population in Uganda, but also the recent statistics by Uganda AIDS Commission show that young people have the highest prevalence rate. So the virus, HIV spreads, new infections are higher in young people.
Humphrey Nabimanya, the founder of Reach a Hand Uganda, says stakeholders and government need to work together to curb down the spread of HIV and rise in cases.
Now see the kind of pandemic that we are facing, and also it's our duty to bring that number down, to have everyone, you and me, to talk about this issue that's a big issue and give it a lot of mileage.
Nabimanya says the achievements out of the campaign will impact the country.
HIV and AIDS, where we talk about the myths around it, where we talk about the effects, and also how we can improve our society, not to be discriminatory, to also to demystify stigma that is really affecting our communities, but also to encourage as many Ugandans to know their status.
Dr. Dan Byamkama from the AIDS Commission Uganda says government hopes to achieve the set goal by 2030 if the strategies set are put into action.
Try to engage all sectors of society in the development of these frameworks and policies. And what I would want to assure the public of is that the government is not short of policies.
Byamkama has called upon the public to respond positively to government initiatives to have HIV eliminated out of Uganda, as well as putting a stop on stigma and discrimination.
We're asking our stakeholders and partners to leave out some of those, and we're guiding them to focus on certain interventions which are of high impact, including HIV treatment, killing stigma, educating the people, pre-exposure prophylaxis for the sexually active young people at high risk, condom programs, PMTCT to make sure no child is born with HIV.
Out of the 38 million people living with HIV in the world, about 1.5 million are in Uganda. 62% of them have been identified as women. Lucky Atari Binjira, CTV, PM Edition.